The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala, and this is Thomas Benarott. Tom is a personal injury attorney, specializes in automobile accident or collisions, people injured, as well as malpractice, and he's been doing that for a lot of years, as well as before he went to law school, he worked for insurance companies and has worked for several law firms, and now he's a partner in a law firm in Roseville, Minnesota. Am I correct about that?
Correct.
Great. And we've been doing a series on whiplash injuries. This one is titled Risk Analysis Long-Term Effects, it should say, of whiplash. So we're going to look at some x-rays here that Mr. Benarott uses in court cases, and of course he sees a lot of chiropractic files, a lot of chiropractors' x-rays and x-rays made in hospitals and clinics of people's spines and other injured areas of the human anatomy. And so we're going to look at them, and we're going to begin by looking at two pictures of what is referred to as the cervical spine or the neck. And so if we look at the one in red or orange, maybe it looks on your screen, we're looking at a side view or a lateral view of the cervical spine up at the top and the back. On the left-hand side is the part of the occiput, the skull bone. And then those little bumps as we go down, they look kind of like piano keys, or there's a arrow on them. Those are called spinous processes. And I believe that God put them there for attachments for chiropractors to use to put bones back in place. And but that they're levers where ligaments and tendons are attached, and when a vertebra goes out of alignment or is injured, it's either going to go right or left or up or down or tilted either to the right or the left side. Now if we go to the right side, we're going to look at an x-ray. Basically the same issue but in black and white, and we see in the front of the vertebra, on the front of the x-ray there, we see the fronts of the bodies of the vertebra, and they're showing them to you now with the arrows. And then in between those vertebrae are disc spaces. And that's a relatively normal disc that they're pointing out to you. And then in the back, if we go down a couple, we're going to look at an area of anatomy called the intervertebral foramina. It's like a window or a hole, and they're putting the arrow right on that now. And that's where nerves, arteries, veins, lymphatics, and acupuncture meridians pass out from the spinal cord. And they would go out to that person's throat and neck and affect all of the nerves and blood supply down into the upper extremities. So that's why some people who have been involved in cervical or neck injuries will come in and complain to us that they have pain in their arms or hands or shoulders, or numbness or tingling or burning. Diagnostic term for that is, one of the terms is radiculitis. So now we're going to go to the next slide, and we see what happens very often, and I think Mr. Benarott sees a lot of these because he's an attorney. I don't know, I've met many of them who take that much interest in their clients, and but he's an attorney that wants to know about human anatomy, and I have to always be careful what I say to him because he knows if I'm right on target or not. But he does look at x-rays of his clients that are made in medical clinics and chiropractors' offices, so he knows what's going on. And interesting, he's an attorney that has a very good understanding of thorough professional chiropractic care as well. He knows good chiropractors from those who maybe aren't as thorough as they should be. So if we bring that slide back up, Mr. Benarott's going to talk about what happens to a neck often in a whiplash injury.
If you compare this one with the prior slide, which we don't need to do now, but you remember that there was kind of a normal curve to it. You can see there that it's natural, and if you actually laid a piece of paper on there, everything would line up pretty well. If you go now to the next slide, that slide there, you see is phase one, there'll be a couple that follow it, show what happens, for instance, in a case where somebody gets rear-ended in a car accident where everything isn't in alignment, and if you laid a piece of paper on there, you'd see that it was out of alignment, where there's a abnormal straightening of the cervical curve. Probably, I suspect you'd say, Dr. Lala, one reason for that might be because of spasm. But the importance of this is again, as we talked about earlier, early identification, treatment to try to get the natural curve in the cervical spine back. If not, what happens a lot of times is there's going to be friction between the intervertebral bodies that's going to cause degeneration, spurring, arthritis, and many other negative things that will, depending on the age of the person, affect them throughout their lifetime. Obviously, the younger you are, the longer you have to live, the bigger the effects, but at any point in time, a lot of times this film here, if compared and contrasted with a film 9 months later or a year later, you can even see significant changes there that have developed because of either a lack of jumping on it early to try to fix it, or sometimes even just because of the severity of the impact that caused the straightening of the normal curve.
And we talk about post-traumatic brain injuries and automobile collisions and falls and strains, but there's also post-traumatic physiological structural damage, of which we'll see in some other x-rays that you've brought along today as well. So let's take a look at the next phase now. And that's a real interesting comparison. This here now on your far left, that person has lost that normal forward cervical curve. It's supposed to be like a C curve there. It's called a cervical lordosis. Well, they've lost that, and we call that a ramrod spine. A ramrod cervical spine looks like a ramrod, or reverse cervical lordosis. Hypolordosis, in other words, when the films, like we have all of our films that we make read by a chiropractic radiologist. And if you're going to a doctor, now you go into any medical x-ray that's made, believe me, they have a radiologist always reads those films. And if you're going to a chiropractor who has x-rayed you, you should make sure that they send those films out for second opinion. It doesn't cost that much money. I've never had an insurance company not say they wouldn't pay for it or anything like that, because even with all of the years that I've been in practice and other doctors in our clinic that I can seek opinions from, it's easy to miss things. So let's bring that slide back up again and take a look at that. The second opinion is important also from a medical legal perspective, isn't it?
Absolutely.
That we have other experts who corroborate, is that the correct word, or substantiate the initial opinion?
Yeah, and I mean, if nothing else, just give you the peace of mind, and you've had someone else look at it, you're reaffirming what you found.
That's right. So second opinions are important. Don't just go by one doctor's opinion. So they're going to use the pointer now on the far left slide and show the disc up there, be about between the second and third. Or the first where he is right now, the disc space is almost totally absent up there. If we go up a little bit higher, there's degenerative disc disease there. And interestingly, on the MRI, there is also a disc herniation there. Now we're going to come down, and we see a relatively normal disc, but if we come down to the next one, we see a little bit of a disc out front where they have the pointer, but none in the back. It's all the vertebrae actually rubbing on each other. Now, as it's being pointed out, those two vertebrae have actually collapsed together. The discs are so badly degenerated. And so these things take months to develop. And if they don't have good chiropractic care, and I don't know any other profession that's more specialized in training to take care of whiplash injuries than doctors of chiropractic, especially those who have specialized in auto collision injuries, to try and prevent those issues from occurring as well as correct them when they do exist. So now if we'll look at the next slide, we're going to see a progressive degeneration, and it goes on and on. And so what we're looking at, if we look here a little further now down on the x-ray, we see hardly any disc left space. We see a nice disc almost on the bottom of the film, right there. And if we come up a vertebra, see there's hardly any disc left there anymore. Well, I know there's some people who think they have x-rays in their hands that they don't need to take x-rays, or they may just take 1 or 2 x-rays in the neck. That's not adequate, folks. All of the medical textbooks and chiropractic textbooks say, hey, we call them a Davis series. And they're legitimate x-rays, and sometimes they just are too busy or don't want to take the time to do that. So let's look at the next slide that they have here for us. Now we're going to look, Mr. Bennerud's going to talk to you about the lumbar spine or the lower back, and we're looking at that from a side view, right?
Correct. And actually, if you think about it in contrast to the cervical, the curve is obviously in the opposite direction, but again, it's a normal cervical curve, kind of again, a reverse C shape in this case. Again, what you want to do is you kind of line everything up. If you laid a piece of paper on there, you can see that everything's in alignment. You see all the disc spaces where the intervertebral area is in between. They're all pretty symmetrical, and plenty of space there for the disc in between that cushions the vertebrae themselves, so that you don't have any kind of bone on bone, and furthermore, you don't have any nerve issues that are causing pain and or irritation anywhere else.
Then, of course, we have the X-ray on the other side, and they're pointing out to you where the pointer is. Those are called the intervertebral foramina. Those are like little windows where the nerves, arteries, veins, and lymphatics pass out from the spinal cord. And for example, in that area of the lower back, they would go out to, if it was a woman or man, the reproductive organs, as well as the urinary bladder and prostate in the male. And if we look at that third and fourth lumbar disc, we're going to see a pretty good shaped disc there. He's bringing the arrow right there, nice and thick out front, but it's getting narrow in the back. If we compare that to the one below, it's thick out, it's very narrowed in the back. It's like wedged like a doorstop. It's nice and wide out front. And if we go down to the last one between L5 and S1, that's sacrum, L5, S1, we see hardly any, the bone is almost bone on bone. And if we compare that little hole there where he has the arrow, that intervertebral foramina, we compare that to the ones above, see it's so small. So that would be logical to assume that that person would be having an interruption or a lack of proper nerve and blood supply out to their reproductive organs, digestion, as well as that big sciatic nerve that runs down into the lower back. So let's look at the next slide now. And I think if we go down to on the far left, we're going to look at, there's hardly any disc left down there between that last vertebra and the sacrum. Very, very little disc left down there. And there they're showing it to you. See, it's wearing out because that bone or those two bones have been subluxated or out of alignment. And they weren't corrected because nobody saw the problem there and they didn't correct it. But compared to the one above, see, it looks really good. It's a nice healthy disc up there. So if we go to the next slide now. Now this is progression, and what we're looking at here on the far left is that lumbar spine again. But see, this person hasn't been treated adequately years ago. And so we move down the vertebra, the ones up top look pretty good, but then all of a sudden the fourth one down, which would be the third lumbar, that one there, look, it's way shoved forward in comparison to the one above, so it's subluxated, and then it has these little beaks of a bird or pencil tips out at the end. Those are called spinal spurs, osteophytes growing out there. And so what the human body is doing is trying to grow extra bone on there. And if that continues to grow, it will fuse the vertebrae together, as they're showing you over there on the X-ray now. It will fuse them together, and then we call that ankylosis. And there are orthopedic tests that we're trained to do that would give us suspicion of that occurring, as well as X-rays. Now, if we look out at the front there, they're pointing out that's the individual's abdominal aorta. That's the main artery that comes out of your heart. It starts out as the thoracic aorta and then comes down into our belly, called the abdominal aorta, and then it divides off into the innominate arteries, which give you the blood supply into your legs. Well, we shouldn't, even though these are very good quality X-rays, normally you wouldn't see that abdominal aorta there, and the reason that we see that is because it's beginning to calcify, it's beginning to harden, it's beginning to develop plaque in it called atherosclerosis. And we certainly don't want any chiropractor or massage therapist or physical therapist doing anything to your lower back without knowing that that exists, because they could rupture that, they could herniate it and cause some very, very serious problems. And Mr. Benarott and I are very aware of that because he certainly, besides seeing people that have been injured in automobile collisions, that have been involved in malpractice. And these are issues that all chiropractors know about and medical doctors, and so there shouldn't be a mistake made, where we're treating those areas and not treating them correctly, right?
Absolutely. Mm-hmm. That's why, again, the importance of the film, the importance of thoroughness. Mm-hmm. You keep yourself out of trouble.
That's right. I was thinking about, if you're in a clinic where it's very, very busy and they're really running a lot of people through, there is a higher predisposition, as we know, in risk management seminars. We're not saying that it is, but there's a higher predisposition. Their risk management barometer is much higher for malpractice because they're pushing people through.
Right.
Instead of taking time, with people and being very careful and very detailed.
Absolutely.
And a lot of mistakes made that way. So let's take a look at the next x-ray now. We have some really interesting films for you. And these aren't really 6 films. We didn't bring these up to show you, to scare you or anything like that. This is just reality, just absolute reality. So here we're looking at the lumbar spine again on the far left. And if we go down by the 4th and 5th lumbar, you're going to see hardly any disc left there at all, just almost nothing left at all. It's just all degenerated and worn away. And if we go up to the vertebra above, we're going to see the front, what we call the anterior superior surface of that vertebra is wearing out. And it's just like somebody's taken a file and filed it down. So it's just being rubbed away. And then, as he was pointing out here, there's some little like beaks of a bird or pencil tips growing on the front of the vertebra there. And those are arthritic spurs. And I would tell you, I've been in practice nearly 50 years. That's because I started when I was quite young. Been in practice in 50 years, and one of the major issues in malpractice in chiropractors' offices is chiropractors treating people's spines without having x-rays of them first.
Absolutely.
The x-ray shows you more than anything. And you can go and save some money by not having x-rays made, or somebody says they've got x-rays in their hands or something like that, or they've got some instrument that tells you what's wrong. Well, there isn't any instrument that's going to tell you exactly what's wrong, nothing in comparison to x-ray. And actually, when there's not an x-ray made, it ultimately, in the long run, costs the patient more, because it costs them more money because other things are going to occur that should have been identified long before that. And that means that they're going to have more chronic health problems or loss of health as they get older. Would that be right?
Very true. And I guess the 2 key things I think about are, you want the x-ray to identify the problem, but then secondly, you have to do the other thing and make sure that you have it interpreted by the proper party too, because it's great to have it, but if you don't interpret it correctly, it doesn't do you any good.
That's right. And the faster, and people, I struggled with that for years, that people would come in and say, well, gee, you're not very busy today. And God, I think, how could they think of that? They haven't seen the number of people I've seen today, And I say, what makes you think that? Well, there's only 1 or 2 people in the reception room. Well, you struggle with that, thinking that success is based on how many people you have parked in your reception room or how noisy the place is. That doesn't make sense at all. You should have an appointment schedule, stay on the appointment schedule so people aren't sitting around.
Right.
5 minutes, fine, but stay on schedule. But if you're running people through, like putting people like a piece of cattle on a hook in a slaughterhouse and just running them through, the likelihood of that being a very thorough doctor is quite low, in my opinion. And I have a right to give that own opinion, don't I, attorney?
You do.
Or counselor?
You do.
So let's, you brought along some slides on the risks of long-term symptoms of whiplash. Maybe they can bring that up when they're ready to do that. Can you talk about that, sir, about women? Is there any difference in women injuries and where the impact, rollovers and things like that?
Yeah, absolutely. And we talked about this some in session 1 of the acute phase too. But historically, females have a higher incidence of long-term issues. Similarly, the type of impact, certainly the gravity of it, if size of vehicles and things can play a factor, but the direction of which the impact is, if you're in a rollover collision, you're going to get a different trauma than if you get hit, in the side, in the rear. Where the impact is has a large impact on what it does to your body. What happens with your body then dictates what happens to your spine. And again, that's another benefit, getting a good history and knowing exactly what happened to the individual to better try to identify what their problems may be.
Mm-hmm. What about, do you think that rollovers are significant, or higher impacts are more significant than low impacts?
Well, I think that could probably be debated. I think it depends on the person, for one. It depends on the vehicle, for number 2. Depends on the condition of the person to begin with, among many other things. Certainly, I think you can make an argument that a rollover incident can be greater, but equally, somebody can get hurt in a collision where there's a lower impact too. It depends on where the hit is, how their body's positioned, where the headrest is positioned, among many other things.
I know we've got another slide here that's really good that talks about ligamentous instability.
Right.
And of course, orthopedic neurological exams help us identify that. And again, that goes back to thoroughness.
It does, and it goes back to having an X-ray early on to try to validate the, you can look at it and compare the X-ray from early to late. The first lawsuit that I ever tried was something similar to this. It was somebody that had an injury to the temporomandibular joint, or the joint, kind of the jaw joint, I guess, for lack of a better way to put it, where the X-rays in the end were the key to demonstrating the ligament injury, the difference between right away and later, and trying to show the difference between a normal and an abnormal.
You know, and that's so easy because I look at, is their head on straight? I'm not talking about psychologically now, but is their head on straight? But if the head is tilted, say, for example, to the right, then that's going to not only affect my neck because there's tight muscles on this side pulling it over like that, and it doesn't have to be as exaggerated. I'm just exaggerating this for illustrative purposes, but that's going to affect my temporomandibular articulation, my bite, which is going to affect the way I chew foods, the way I talk, and that's going to affect not only function of the jaw, but possible pain. And a lot of times, if the doctor that they go to doesn't do a good postural analysis and then confirm that by X-ray, because the X-ray can show muscle spasm, it can show ligament damage, and many times, we need to refer them out for an MRI or a CT scan, which is the regular X-ray really shows us bone, and if you have sophisticated X-ray equipment like we do, then you can see these things on muscles, but the MRI or CT scan is going to be a much better way to view the soft tissue injury.
Absolutely, but again, it comes back to if you identify it on an X-ray, to get those subsequent and more detailed films.
We have objective evidence rather than saying, oh, that's just in their head, or that they want a green poultice, they want some big settlement, from an insurance company. And if it's not there, it's not there. But if somebody doesn't look, you can't identify.
Correct.
You can't identify. How about, do many people complain of shoulder injuries from shoulder harnesses, or abdominal injuries from their seatbelt?
Yep, absolutely. And again, it goes back to position of the vehicle there is key. If you're the driver, it's going from left to right. If you're the passenger, it's going the other way if you're in the front seat. And again, that all helps you identify complaints. And kind of, in a sense, as a practitioner, I'm sure it helps you kind of confirm whether or not the injuries match, what's going on otherwise, and kind of help you validate the complaints that exist.
How about rib or breast or shoulder injuries themselves? Do people complain to you? I know they do to me.
Always. Whether they hit their chest on the steering wheel, whether the seat belt caught and hurt them that way. And again, from a practitioner standpoint, a huge concern because you could have a viscous tear or something like that. You want to identify all those things so you can think of all the potential bad things that could happen, so you can kind of cut them off before the patient gets there.
And I find a lot of patients that we see were taken to the hospital emergency room, and some X-rays were made of them. Not always, but sometimes, depending on how busy the X-ray or the emergency room was at that particular time, and also how badly they complain. And a lot of people have just these tremendous rushes of, they don't realize it, it's not like a psychological rush, but a rush of these endorphins, and these endorphins are anti-pain chemicals. And so they're saying, well, I'm not really too bad, I got a little pain here in my shoulder and that, and the doctor says, well, can you move it fine? Yeah, I can move it fine. And they just want to get out of the hospital, and healthy people want to get out of the hospital anyway. And you can't blame the patient, because I know I go to the hospital every week, to see people and things like that. And it's not one of my joyous times of the week to go to the hospital. They're not very positive places.
No, I don't think anybody likes to go to the doctor, and everybody wants to get out of there, and they're worried about cost and other things. And at that point in time, they're still of the belief, because of the way our minds work, that you want to get better. You don't want it to be that bad. You want it to go away, and probably to some degree too, like you said, shock, endorphins, just the natural mechanisms of the body kick in, and
that's in that acute phase again.
Right.
Because there are, as you know, pain receptors or endorphin receptors inside of, all throughout the body, billions of them, and they're inside of bones too. So if there's been an injury to a bone or a muscle or ligament, those hormones, that's what they are, these endorphins, neurotransmitters, another name for them, they're pumping out of the body. The adrenal glands and the brain are pumping out these chemicals, and we're saying we're not really too bad. We're okay. We just want to get home, or maybe somebody doesn't want to have, maybe rarely, once in a while, somebody may not want a drug test performed on them while they're in the hospital, after an accident. But so many times the symptoms become masked by the body's survival mechanisms, such as through these endorphins. Or sometimes people are real macho in nature and they just say, I'm just not going to let this happen to me. Or sometimes people feel, or maybe a policeman or policewoman has misinterpreted the cause of the accident, right, if the police were called. And they think, well, I'm at fault, or looks to me like you were 50% at fault. Well, that's the policeman's opinion, but it's really the attorney's opinion, right? Who's at fault?
Ultimately, that's the case.
Ultimately.
And again, the sooner you get involved, the sooner you can figure it out and get good information.
And I think that behooves us to bring up the point again that people, because I specialize in this area, always are asking me legal questions. And I just say, well, and some of them I think I know the answer based on experience. But I say, look, I'm not an attorney. See those diplomas and those licenses on the wall? None of them say Minnesota Bar Association, whoever gives you your license and things like that. It wouldn't be the Bar Association, would it?
No. Minnesota,
whatever, that your licensure goes through. But I just say, look, you need to speak to an attorney. Well, I'm afraid that's going to cost me some money, or I'm afraid, to get involved with attorneys. That's silly under Minnesota no fault, isn't it?
Right. Free advice. You call my office, you get free advice, and you get a free consultation to determine whether I can or can't help, and if nothing else, at least then you know your rights.
And I like that because it's a service to serve people, and there's two different approaches in life. Either the doctor or the attorney is survival-oriented, that's going to do things for their self-survival, or we're going to be service-oriented and kind of look at every patient as if they were Jesus walked in the office. And would we take a good case history on Jesus? I think we would. Would we take x-rays? No, just get in the table. We'll crack a few bones. Or an attorney, just sign this paper. I'll call the insurance company. They'll have a $1,000 check in your mailbox next week. Yeah, sure, you do that to Jesus. And then Jesus ends up with all these problems in his spine later on. And I'm not, I'm not talking about religion now. Call him Muhammad, whatever. All right, whatever president. We won't mention the president's name of our country right now, but if the president of this country walked into our office, regardless if we agreed with their political party, we wouldn't just say get on the table or, don't worry if you're an attorney, don't worry about it. You don't need any legal advice.
Try to treat them like you would your spouse, your child, your friend.
And if we have such low self-esteem of ourselves and so low self-respect of others that we devalue the humanity of others, that we wouldn't do adequate jobs for them, it says something, doesn't it, that we're not thorough. So anyway, we've enjoyed having you with us. We think we have at least one more session to go through. We're just extremely pleased to have Mr. Benarat with us. Good to have a good, honest, ethical man and somebody who is well experienced. You want to deal with attorneys and doctors who are specialists in their particular areas. You don't want to call me for a dermatology problem, all right? I might know something about allergies, but you got a big infection, call a dermatologist, okay?